We're on to week 6. In week 6, we're going to be reading about, learning about, speaking about for this communicable diseases. So, the overview is what our topic is about and our learning outcomes. So, we know that a communicable disease is defined as an infectious disease that is transmittable either by person to person, by direct contact with someone who is already has the virus, or the individual's actual discharges, whether it be sexual fluids, sneezing, etc., or by indirect means, such as a vector. So we're going to really look at some concepts concerning preventing the transmission of and the treatment of communicable diseases. And we're going to talk about one specific communicable disease, which is an emerging or evolving. It emerged, I believe, in 2022, and it continues to evolve infectious disease. And that is Mpox, originally called monkeypox. So we're going to look at that specific virus more in depth in this learning unit. So you're going to look at, or you're going to read your textbook, chapter 13, but there are some very specific pages that I want you to focus on that I've assigned as reading. So pages 351 to 365 and 397 to 400. The quiz for this week will be based on these specific readings. You're going to be reviewing web links from the CDC on Mpox. And while you do have a discussion board post, no reply is required. So please do post by Friday evening along with your quiz. So the required readings that we've just gone over, your quiz number 6, remember it's specific pages. You have to complete it in one setting, but there is not a time limit for this 10-question quiz. So one of the articles that I've put in here is in follow-up to last week when we spoke about the social determinants of health. So this article is, does the general public understand the social determinants of health? And while you might not be able to get through the entire article, I really encourage you to read through at least the first 2 pages. And I want you to be asking yourself, do you still view health as an outcome of individual choice only? So this is in follow-up. You're not being tested on it, but I really think it's important to read, and it's not a lengthy, tough-to-read research article. So I ask you that you take that information to take you to the next level of truly understanding the social determinants of health. And then you've got a folder. So here is, just a document in the picture. When you see a folder, you know that you have to click on it again, and that will allow you to see additional links, articles, whatever. So again, we're talking about Mpox, which is an emerging and evolving communicable infectious disease. It's a virus. How is it prevented? How is it transmitted? And how is it treated? And then we're going to look at, where's this virus occurring globally? This is global health. So yes, we're concerned about our own country, but we also know that Mpox has been in specific states of Africa as far as its, I'll get into that in just a minute, but we know that just like COVID, it can begin in a different country, a faraway country, and then with our global economy and global travel, etc., that it can become a virus that's easily transmitted to different areas of the world. So we're going to look a little bit about what are the signs and symptoms of Mpox. Now, this information comes from the CDC. So it's talking about the rash, other symptoms, how long it lasts. Now this is for the general public. So what to do if you have the symptoms, and there's even some rashes, pictures of rashes that are indicative of Mpox that you may be interested in. So it's not super lengthy, but I encourage you to review this information so you become more knowledgeable. How is Mpox transmitted? Now, there's an important statement about Mpox is that there's two types. They call it clade 1 and clade 2. So both of these clades, both types of Mpox can be spread through direct contact with either infected wild animals or close contact, including intimate or sexual contact with someone who has that type of Mpox. So then it talks a little bit more about different things, and can we get this virus by just contact with objects or fabrics that have not been disinfected after used by someone with Mpox, and that is the case for this. So, but we also want to read through everything. No evidence suggests that people who never had symptoms can spread the virus to someone else. So this is someone who is symptomatic, and it's while some people perhaps can spread it in the days before they have symptoms, there's no evidence of that yet. So you can read through this information as well. So we're talking about what is Mpox, how is it transmitted, and then vaccination. So vaccination isn't just something that everybody gets. So you can read about who would get the vaccination at this time, and especially living in the U.S. And if you want the vaccine or you're symptomatic, how do you go about getting it? So again, this is just a short bit of information, but you will understand better about the vaccine for Mpox. And then we go to Mpox in the U.S. and globally, and this is one I want you to spend a little time with because it's talking again about the two types of Mpox, clade 1 and 2. And then it's talking that in U.S., our country, clade 2 is circulating, but at low levels. We do not have any clade 1 infections. So that is important to know. But again, how about across the globe? And so this is where the Democratic Republic of the Congo has had both cases of clade 1 and clade 2, and so you're going to see it actually on a map here. So any of the clade 2 cases are in the blue, so light blue, so you can see us, and you can even click on what country. Then you can see who has clade 1 and who has both types of Mpox. So clade 1 is the blue, Democratic Republic of the Congo. You're going to see Libya, so you can see how it is spread to neighboring countries. And then having both types, clade 1 and 2, you're going to see it's Cameroon. And so you're going to really have an opportunity to kind of look at where it is. You can also see that it's in Thailand for both clade 1 and 2. So feel free to look on the map, but you can see how it can start, you can start in one country and how it can spread globally like COVID did. But yet, if it's well controlled, we won't have that spread. So it's important to look through this information. And finally, also from the CDC, all of this is from the CDC, is kind of, I believe, the most interesting of all. As nurses, we need to talk about different viruses and infections that are specific to people that may have different ways of life and different sexuality preferences, etc. Just like it started with HIV transmitting to AIDS, It started mostly with men who have sex with other men, spreading the virus, but yet how it can be spread also to men who have gotten the virus, who spread it in other with females, etc. So this is kind of a nice educational tool, and it helps us to better be able to talk with anyone that we might come across with who is at risk for or who shows symptoms of mpox without judgment, without having to have the same type of lifestyle as they may have, perhaps, but no judgment. That's part of nursing, helping, caring for others. So this is just a really nice who should, what do you do if you have new or unexplained rashes or symptoms? And, it's just really good information for the general public, but yet I think it's important information for nurses to read. So I will let you go through that information. So again, it's important to share accurate information to protect people from harm, especially when we're talking about communicable diseases, because the general public hears like the possibility of an emerging disease, and oftentimes there's not accurate information associated or misinformation. So those who have different lifestyles, who make different choices than us, we are still caring for, educating, and treating that individual without judgment. But we have to be aware of our feelings and also be aware that persons with sexually transmitted diseases and infections, it's now sexually transmitted infections, often feel stigmatized. They feel shamed, like they have a mark of disgrace or honor. So it's important for us to be aware of what we believe and how we care for other individuals. So the discussion board post is based on your readings of MPOX. So after reviewing these readings, please provide a summary of what you learned about the disease itself, symptoms, transmission, prevention, as well as how best to provide care and education with persons that are at risk for or who have sexually transmissible infections such as mpox. I started reading a lot about mpox when it was called monkeypox. No replies are required this week, but I do hope that you review a few posts from your peers. And have a great week.